One of those cases hits very close home for us here at KETK. Our friend and colleague Neal Barton recently tested positive for the virus. He is recovering at home and he wants to share his experience with all of us. Neal, you're talking about it took a while for you to go get tested. Why did you take as many days as you did to go finally get the test?
Well, first of all, you know me, I pretty much suffered through. I just got anything out. All the characteristics were like a summertime cold. That weekend of July the 4th, I had some congestion in my throat. It quickly moved into my chest. When that happens, that means summer cold. And so I didn't have COVID-19, I didn't think. I was okay. I was just having the normal summertime bug. And again, my doctor was not taking anybody who's sick, imagine that. And so I went ahead and gutted it out because I thought this would go away. It's a summertime thing, but it just wouldn't go. And Thursday afternoon, believe it or not, my wife and I had to go down to the farm to mow because, you know, if you have property, you have responsibility. Yeah. So we went to go do that. And God, I felt horrible. And then I was drinking an energy drink and realized I couldn't taste it. And then I thought, uh-oh, this is sounding close to home. Everything else was kind of sounding summery and kind of the sniffles and maybe the summer cold, but this sounds a whole lot different. So Friday, we decided to go get checked. And luckily, at Transparency, they're a sponsor of ours, but Hospitality ER, it's a triage thing. You walk in, it's a 3-hour test, but in 3 hours, you know if you have it or not. Mm-hmm. And she walked in with her big, with her Darth Vader mask, scared me to death and said, "You got it, and you also have associated pneumonia." And so we even asked about hydroxychloroquine.
Yeah.
Yeah, I'm a little foggy-headed right now because of all the medicine I've been taking. I don't even know what day it is, but they said that would be very dangerous for me. Don't take the hydroxychloroquine. And so they gave me a whole list of meds for pneumonia, and that's what I'm taking.
Gotcha. Well, and you keep on saying we in this factor, we being your wife, Renee. How is Renee doing? Because you got to think, you know, as contagious as this virus is, if your spouse has it, then you probably have it.
Well, that's exactly what they said. The deal is she was fine at first, and then she started succumbing to different sort of characteristics. And so she went to go be checked yesterday, and the doctor told them, well, if you're living with someone who has it, you pretty much realize you have it, you sound like you have it, and so 14 days quarantine. Yeah. And so we're locked up here together with what we call COVID bear. And so it's for my comfort bear. So we both have it. And the biggest problem I've had, to be honest with you, the minute I started pounding the medicine on Friday night, I started feeling really good. I thought the biggest problem I'm going to have is not being bored out of my mind. Yeah. But yesterday morning and this morning, I woke up with pretty high fever. And so anytime I do that, when I wake up with chills, it takes about noon to start feeling better. Mm-hmm. And I had the same problem today. Man. But besides that, everything has been pretty easy. It's been like a summertime cold. Yeah. Well,
that's wonderful to hear. Now, let's bring in Dr. Mark Anderson. He is the Chief Medical Officer at Christus Health. And Dr. Anderson, thank you so much for joining us. Is Neal's story typical of what you're seeing here around East Texas?
It's pretty typical for the low acuity symptoms that we're seeing. We see a wide variety of symptoms from a cough and cold, or even patients just reporting this as potentially allergies, to the most severe cases, of course, which end up in hospitalization. Mm-hmm. But that is typical of a very low acuity case.
Yeah, and speaking of Texas hitting new highs with cases, deaths last week, and hospitalizations, what is the number one thing that people need to know about this virus?
Well, it is still dangerous to certain patients. We haven't determined which patients that is exactly yet. We know age is a factor. So we still need to be very careful with social distancing, with masking, with cleaning your hands, cleaning your surfaces, because we're continuing to see a surge in our hospitals as well as outpatient settings. Mm-hmm. We've doubled the number of patients that we have in the hospital in the last 2 weeks.
Wow. And now that we're 4 months into this pandemic, what have doctors learned about treating this illness? I know in Neal's case, he has pneumonia, and so they're treating the pneumonia, but what about treating the virus in general?
Well, we do have medication called remdesivir that has been an allocation from the government. We're continuing to get that supply. That's appropriate for our hospitalized patients. We also know that, at least from recent studies, that steroids appear to be very helpful in this condition. So we're administering steroids in our hospitalized patients. But for those more serious cases, of course, that ended up on ventilators, we have a variety of tactics that we have to utilize in order to get them through their episode on the ventilator, which can last a couple weeks.
Wow. And we understand that blood plasma from recovered patients is also being used successfully on current patients. Can you describe how that works? Have you seen that in your hospital?
Yes, we use it very frequently too. From a patient who knows that they've had COVID, have had a COVID-19 test, they can go donate plasma at their local blood bank, and that plasma is used on patients that are acutely ill in the hospital. It provides a source of antibodies to fight the virus and keep it from spreading. It attacks the virus directly. So it has been an effective therapy at this point, and we continue to use it as well.
Wow, that's incredible. Now, Neal, we're so proud of you for wanting to educate our viewers about what you're going through. Before we go, is there anything else that you would like to say?
Here's why I'm doing this, okay? Not to say, hey, look at me, because trust me, right now, looking at me is pretty bad. But just to take, as we always say in the news business, put a face on it. Okay, right now, I'll be the face of it. A lot of us, like me, I never hardly ever get sick. You know me, once in the winter and once in the summer, I come down with something, and that's about it.
Yeah.
But you can get it. It can happen to you. But don't be afraid to go and be tested. Once again, the best advice given to me from a Beaumont friend who has it right now. He runs a hospice, so he's exposed to almost everything. And he just told me, man, if you think that you're a bubble off plum, things are just not right, things are not right, you owe it to yourself, to your workmates, your schoolmates, to go get tested.
Yeah.
And so I did. And look at me. I was stunned as anybody. I had it. And the last thing I wanted to do is go to work and wipe you guys out with it.
Yeah.
And so I'm glad I did it. And the good news is, the positive news, I've had it. So I'm done. And so I hope before long I'll start spitting out antibodies and I'll be in good shape. I'll still wear the mask and cooperate, but at least the relief is there. I've had it.
Yeah, the worst is behind you. That is a blessing that, you know, we haven't been able to experience yet, if there is one, the silver lining. All right, Dr. Anderson, thank you so much for joining us. Neal, we're keeping you and Renee in our prayers. We miss you a lot, and we pray for total healing and a very speedy recovery. Thank you so much for joining us.